Welcome to Black Health Now, the September edition. Really excited to host this. Harrison and Star is really excited to host this series for September. And my name is Paulette Robinson. I am the EVP of Digital Growth at Harrison and Star, and just had the pleasure of helping to plan this amazing event with Philip Jeter and Audrey Williams and Tracy Cooper, as well as Therese Kung. So I'm not gonna talk very long. I just wanted to use this opportunity to introduce our moderator for the day, and then he will take you through the rest of this experience, this really important conversation that we are having today. So our moderator for today is Philip Jeter. He's a VP Medical Director here at Harrison and Star. He was born in Maryland, and he attended college at UMBC before moving to the North and for graduate school at NYU. He has a background in biochemistry and pharmacology with a specialization in breast cancer. So this brother is busy and smart. So Philip, thank you so much for being so courageous in leading such an important conversation. I'm going to turn it over to you, and I just encourage everyone, please enjoy the conversation, ask questions, and let's really lean into what Black health means for the Black male.
Thank you so much, Paulette, for that wonderful introduction. So hello, everyone, and thank you for joining us today for our Black Health Now event. So most of us are pretty familiar with the talk that many Black children have with their parents and their family members as they enter into their teen years. Well, today we're also going to have the talk, but this talk is going to be centered around health. Okay, so audience members, if you have questions, please leave them in the chat, the Q&A function. There will be a member of our team monitoring the chat, and any relevant questions that come up during the conversation, during our discussion today, we will take those questions, and there will be additional time at the end to answer questions. Okay, so without further ado, I'm going to have our two panelists introduce themselves. So Dr. Hubbard, would you like to start?
Sure, thank you so much, Philip, and I'm looking forward to this wonderful conversation. So yes, I'm Sean Hubbard, and I've been practicing neurology for about 21 years. I'm from the Midwest originally. I did some travels to Tallahassee, Florida, where I ultimately ended up going to college there, studied chemistry, and then went to medical school later on. And then after that, did some neurology training at Hahnemann University, and I've been practicing in the Northeast up until just recently, and have located now to the Tampa area, actually Clearwater, and St. Petersburg, where I'm sitting right now in a hospital on lockdown because of all the weather events that we're having. But I'm so happy to be here and have this amazing conversation that I think gets overlooked, actually. And so this is an awesome event. Thank you so much.
Thank you so much for your introduction. Mr. Williams, would you like to go next?
Yes, good morning, everyone. I'm Gerard Williams, a cancer survivor, so a fan of all of you. Thank you, the medical profession. And I'm a retired Coast Guard officer, served 26 years on active duty, and I currently work at the Pentagon as a contingency and exercise planner. By way of education, I've got a master's degree in organizational management and another grad cert that I don't use in applied program management. But I am very thrilled and honored to be here and happy to answer any questions. And just really, the word really is honored for me to have this opportunity to share my story and hopefully help some others think about things from a different perspective. So eager to get started today.
Thank you. Excuse me. Thank you both for those wonderful introductions. So before we jump into the actual discussion today, I want to provide some statistics around the state of health for Black Americans, particularly Black men. Now, I do not want to discredit or reduce the significance of health for Black women, but today we really want to focus on a subset of this greater population, which is Black men. This population can often be overlooked. So Black men are 30% more likely to die due to heart disease. Black men are 60% more likely to die from stroke than non-Hispanic men. Black men are also 75% less likely to have health insurance than their white counterparts. So I hope these statistics can highlight the importance of doing more in the Black community, all right, to better the state. So I want to take a moment to mention that before we get into our actual discussion, this is going to be a conversation. So please feel free to ask questions of each other. And again, like I said, that there will be questions from the audience members that we can take throughout our discussion. Okay, I know there are specific questions that we want to address and that we want to answer, but please do not let that hinder you in any way. We want this to be a very open dialogue. Okay, so without further ado, let's jump into our discussion. So let's start off by painting a picture of yourself for our audience. Where were you born? Where did you grow up? Tell us about your upbringing, your family life. Just give the audience an idea of who you are as a well-rounded person. This time, I'm going to ask Mr. Williams to go first.
Okay, thank you. So I am a biracial man. I was born in Rangoon, Burma, which is Myanmar now in Southeast Asia. Audrey and my father was a U.S. Marine stationed there at the embassy, and our mother was a Burmese secretary working at the embassy. So that's how they got started. Grew up as a military brat, moved all around California, Wisconsin, and East Coast. And that shaped me a lot from a diversity and an open-minded standpoint. I will say, growing up as a child, I didn't really grow up as a typical, I would say, stereotypical Black young man because of my exposure to that very diverse set of cultures. So I think that opened my mind, right, to thinking about life in different ways. And we'll cover more of that later on. But growing up, I was into boogie boarding and surfing and swimming, and of course, the standard football and track and things like that. So I was pretty much a jock coming up. Wasn't very tall, still not very tall, but I had a very a lion's heart, right? So I played everything. After high school, went out to the University of Florida for a year, didn't study very hard. So I ended up joining the Coast Guard and serving 26 years in the Coast Guard, doing anti-submarine warfare, then law enforcement, search and rescue. So very much alpha kind of things there. And I think that shaped me in that I was in a very stressful work environment for my whole, from age 19 till now, still, right? I've never been out of a stressful environment. After the Coast Guard, I started working for the Department of Defense, going into Afghanistan, training teams on planning and different things. And now I work at the Pentagon, so very small stress place, right? So stress has been a huge factor throughout my adult working life. And that's one of the things I'm sure we're going to touch on now. Who I am, I have two wonderful children. I currently live in DC. And the thing that I would take away from my life is I'm probably a little bit more open-minded because one of the key factors that you mentioned, Doctor, is insurance. I was advantaged throughout my whole life in that I had really good medical, dental, emotional support in the form of insurance and coverages because of my father's work and then because of my employment, right? So I never suffered from the availability of medical support and care.
Thank you for that. Dr. Hubbard, paint a picture for yourself.
Sure. Okay, so I would say that I had a typical Black experience in a way. Part of my growing up was in Ohio. I still consider myself kind of a Midwesterner. Both parents from Ohio, one, Hubbard, Ohio, my dad, and then Youngstown, Ohio, my mom, both raised in the church. My mom was more strict in terms of her upbringing in the church, and it was so strict that she didn't push it on me per se. And she really wanted me to be aware of my choices, and she would shake me up and say, "Don't let anybody tell you that you can't do stuff that you want to do in your life." And meanwhile, my dad was at Ohio State and had gone into coaching, and ultimately coached at Florida A&M University. And while she was saying, "Don't let anybody tell you that you can't do things," my dad had won a couple of national championships as head coach and was breaking a lot of barriers. And so proving and living part of the life that she was saying that she wanted me to live. But at the same time, he was aware that he was not going to be able to go into the NFL and be a head coach. And this was now 30, 40 years ago. So, I grew up with messages from him also that would shape me that, there might be some challenges at the upper rungs. So this gets into part of the talk, but these things shaped me. I moved from the Midwest then to the Southeast to Florida, and now I'm going from a Catholic school and into HBCU environment. So we're going from north to south and inner city Midwest to now mostly African American environment in the South. And I think all of that exposure has been wonderful. And I think those are kind of the things that shaped me, aside from parenting and marriage, and now practicing medicine in environments where we see people that they don't look a lot like us side to side, but there's some commonalities, and I like I've grown to enjoy the diversity and the broad experience of having a typical 70s, 60s upbringing into now this digital age, and a lot of the opportunities that it invites us to enjoy. That's kind of my background.
Awesome. So I heard both of you talking about, this diversity, this ability to tap into sort of the healthcare system and kind of very early on. So I'm curious, Mr. Williams, what was your experience early on with the healthcare system? How often did you visit your doctors? How often, did you get checkups?
Right. So great question. As I was mentioning earlier, I was greatly advantaged because my father was in the U.S. military. So we had, back then it was called TRICARE. So we had the military insurance. And because I played sports from, I don't know, pretty much the whole time I was growing up, the schools always required, the physicals. So one of the things that my parents never had to do to me was to remind me, because I was always going to them with a note from the coach going, "I need a physical," right? So I was very much, every year I had a checkup from, age 5 through the time I left high school. And then I went pretty much right into the military. So I was always on schedule throughout my whole life. I was really greatly advantaged with that. Now, experiences, I will share one quick thing there, and that is the military system was fine. But one of the things that I believe strongly saved my life was my ability to advocate for myself. When I did get diagnosed with cancer, I was in the military. I was actually the commander of a unit at the time, so a lot of stress there. And they wanted to retire me, right? And push me over to, I was stationed in the Detroit area at the time. And the Coast Guard wanted to send me over to Great Lakes, over by Chicago, the naval facility there, which, and I advocated for myself because my daughter was 4, my son was 1 at the time. And they were like, "Hey, you got stage, 2.5, 3 cancer. You're going to probably die, whatever. Go over there and basically go away," right? They wanted to shuffle me off in the military med. I advocated for myself and actually got assigned, referred to a specialist in the Detroit area, and the doctor saved my life because of experimental medication, So I would say that I've had good experiences, but I would also say that I'm here today because I pushed the system to do the right thing for me. That took me outside of the military system to a specialist, oncologist who was willing to go beyond, right? Who saw me as a special case and gave me specialized treatment, concocting the triad of medication. So that's my story on that, sir.
It's awesome, and that's an idea and a theme that we're going to pull through today during our discussion, this idea of advocacy, whether it be self-advocacy or having someone else on your side as an advocate. It's a very powerful tool. So we'll come back to that. But I want to transition now over to Dr. Hubbard. So did you share similar positive experiences? What were your perceptions like growing up of the medical system, the healthcare system?
My perspectives growing up were influenced by my mother's health and my grandfather's health, and they both had challenges. My grandfather had very typical challenges that I end up treating today, those associated with complications of hypertension and diabetes, tobacco dependence, excess weight, physical inactivity. And so I really wanted to get more involved personally to see what I could do to help patients like that. And then my mom had lupus. Okay, so it tends to affect women more, tends to affect younger people more. And with both of them in and out of the hospital, they seem to be getting attentive care to the extent that my mom wanted me to be a physician. And I wanted to save people like my grandfather. I really had favorable opinions of the healthcare system and the medical system. In some ways, when I hear the medical system, I'm kind of talking about medicines and surgery and IV infusions and stuff like that. And health, I see it as a pursuit for something a little bit higher. And we could talk about that a little more. But my opinions were pretty favorable to the extent that I wanted to get involved. But I'm really understanding Mr. Williams' experience from within, from the provider standpoint, where we see somebody who, if they just step up with, let's say, a typical condition, condition A, let's say it's cancer, and then there's a standard approach, we will more than likely just recommend that standard approach. But if we see that somebody wants more, they want all that there is to offer, the best that there is to offer, even if it pushes beyond the envelope, then it's actually pretty exciting because it gives us an opportunity to be more of what we want to be, and give more to people. And we can say, hey, look, they're asking for it and we're here to give it. That really resonates with me from the inside of healthcare.
Awesome. So I want to piggyback off of that just a little bit. So you talked about the family members that had health challenges and how you learned to become an advocate through them and wanting to do more. So when did you really realize that you wanted to be a medical professional?
I realized personally when I was very young. I mean, first it was something that my mom wanted me to do. She actually had an African-American physician as a primary and looked up to him in a great way. They had a great relationship. But when I went to, even just in high school, I enjoyed the biological sciences and had an affinity toward them and just a curiosity about life and health and how people ended up with the circumstances that they ended up with and how they overcame them. I found all of these things very interesting to really dig into. The more I just followed my own curiosity, the more I knew that I was interested in healthcare itself. So I would say it developed from even childhood, secondarily from what she wanted. But then as I got more into it, high school and then college, and then the closer I got into medicine, the more I was interested.
Awesome. And when we were talking earlier, you mentioned something about the influence of the Black physicians around you. How did that impact you in your decision to also pursue a career in medicine?
Well, that was major. I had a neighbor who happened to be a physician, and he happened to be also a member of a fraternity that I would enjoy and join later on. I had another fraternity brother, but this was in Tallahassee, Florida, where, as it turns out, African Americans have a pretty good amount of influence, and also people know who they are. They're doing things. People ask them for advice. They are there to lend information on all sorts of different conditions that affect our communities. They really look toward. So I really liked what they were offering. I like that they were in a position to offer information, and that definitely influenced me because they seemed knowledgeable and very learned and experienced about everything that was going on. I wanted to be in that position because, it seemed like one from which I'd really be able to help a lot of people. High school.
Awesome. That's amazing. That influence means a lot. I can say from my own experience, I didn't grow up knowing many PhDs at all, if any. So, being the one in my family, it's really different. I see the level of like motivation and inspiration that I have on my younger family members. So, kind of paying it forward. So I want to transition us now just a little bit to get a little bit deeper into the talk. So, Mr. Williams, how did your parents have the talk about health with you?
So there wasn't any really deep talks about health specifically. They certainly encouraged me, but I think that one of the things about me was that because I was playing all those sports, I was always part of that routine care process, if you will. So I was certainly, my father gave me tips on things that he had learned through his time in the Marine Corps, how to take care of your feet, always wear good shoes. So the general things were there, but there were no deep conversations. However, what I did have another advantage of is family in the medical profession, right? So my mother's younger brother, deceased now, but he was a surgeon, right? And her sister was an RN. One of my grand aunts was an RN, and then I have cousins, that are RNs. So when I was diagnosed, I had direct access to these very learned professionals. And that goes to, while I didn't have a lot of direct influence or motivation specifically growing up, as an adult, when I needed to be able to build trust, and that's the word I'd like to anchor on to really answer your question, I had a network of people that I could trust to validate what my care team was telling me, right? So when I told you I pushed off the Coast Guard trying to send me to the Naval Medical Facility because I wanted a better, more specialized oncologist, that's because of the trust and what my family medical professionals were telling me, like, hey, don't take that. Don't take the standard answer. No, you can fight this. You should ask for this, right? So I was enabled. They were always there throughout my life. And in a time of crisis, they were specifically there for me. So I know that kind of went around your question, but hopefully I gave you the insight you were looking for.
Absolutely. And so that's another theme that I want us to think about. And we're going to dabble in this idea of trust and mistrust within the medical system and patients. That does run rampant through the African-American community. So you mentioned that you had some family members, there's RN, there's a surgeon. So what kind of conversations did you have with them about your health? Anything specific, or was it general? Make sure you get your checkups, make sure you do this, make sure you do that. And I know these conversations may have happened a little bit later, but kind of give us, the audience, an idea of some of the type of things that you guys would discuss.
I was that kid who never broke anything, but I was always bruised by something. Right? So most of my interaction with my family medical professionals was like, okay, what's the best salve for this? I just burned my arm on a mini bike kind of thing. How do I treat it? Da, da, da. So there were a lot of very specific ailments and direct, almost self-care kind of things going on. That's really the extent of that. As I got older, they really didn't have to, because like I said, I was so blessed by being within a system that had a structured medical process. I was in law enforcement, so we had to work out a certain way. We had physical exams, and along that, we were every 6 months, we were in the doctor seeing something, So honestly, from a routine growing up, there weren't deep things, which goes to how do we change that going forward, right? So the things that I didn't experience, I will tell you this, as a father, I didn't do a good job of remembering all that because my kids too, they grew up playing sports. So I just equated that, oh, they're part of that and I was fine and they'll be fine. But I think now that they're out of the house, they're adults. And because of this opportunity that, you've started me thinking like, okay, well, what advice will I give my kids for my grandkids, right? What advice would I give the audience now? And that is, what tools do we have, right? So now we're starting to have a network and, and talking to Dr. Hubbard, I would say, what questions should we be asking our children and our family? And where do we go to find the answers, right? So how do we start building those tools within our community so that all of us have a checklist, right? Because that's what our parents didn't have, unless you were in the profession. So I would say, and I would challenge all of us, is maybe we need to do things like think about building checklists for those of us who don't have the same level of education or the same access to the information or to peers or people, right? Professionals. How do we set that up going forward?
Dr. Hubbard, I want to pass it over to you now. So thinking about your upbringing, how did your parents have this talk about about health with you? What tools did they direct you to? What resources did they provide to you?
That's interesting. In discussing before briefly, I was not able to think of a discrete moment when we had the talk, and particularly as it regarded health and medical care. My messages that were passed on to me were definitely more general, but they had health and medical implications. And so, for instance, the talk that my mom would have, it's more, don't accept limitations, don't let somebody tell you that you can't do something that you want to do or become who you want to become. She wasn't, she was one that was very much not into being held down by structures and institutions and things like that. Just keep pushing, figure out what you want out of life. I'm not going to make all these decisions for you. You figure out what you want, and then you figure out how to get there. And my dad was pretty much the same way. It was a very supportive environment. I remember my dad and talking to his dad and other members of our family and saying, hey, look, some of the best exercise that you can do is to just put your hands like this, and he'd hold his hands like that, and then push yourself away from the table, And so he was, in essence, saying, you probably eat more than you should. You probably eat food that you shouldn't be eating, and we can control our health outcomes if we really desire to. So these are the messages. They were really not heavy, hard-hitting messages. Do this, do that. If there were some don'ts, it was don't accept limitations and just standards of what's being said today, right here and right now. And though my mom passed away, my dad still practices the same ideology right now. So he's been able to keep his hemoglobin A1C down. He does sprints every day right now, 10 of them, like 20 seconds a piece. He's like 76 years old. So these have been reverberations that he has passed along to me, and that he still lives, and that impress upon me, and that I'm able to have these types of discussions with patients that I sit with every day. So this really has influenced how I look at my own life. These were different types of the talk per se, because they have everything to do with how I proceed when I'm making health-related decisions, and how I look at my options and choices in life, and what I pass on. Now, I should just add also that because of this kind of upbringing, I didn't necessarily feel that there was somebody keeping me away from what I wanted. And so I grew up without necessarily, I wasn't playing defense very much. Mostly I've been growing up with an offensive strategy toward life. And I really didn't feel that there was somebody holding me back per se, holding, and it has had implications. And so I just want to put that out there because I think that, part of our discussion, perhaps will go in that direction.
Dr. Jeter,
Yeah, and I love that idea. Yeah, so
if I could add just one other thing, it just, as Dr. Hubbard was talking there, I'm reminded that my grandfather on our mother's side, and then my father, they weren't great men who spoke at length on an emotional topics, right? Grandfather, Indian Burmese man, Sergeant Major in the Royal British Engineers, Second World War kind of guy. He led by example, right? And my father, United States Marine Sergeant Major and officer, once again, led by example. So what I might not have received in words, I certainly lived in watching these men and how they carried themselves and how they interacted with others. So both of these men were strong spiritually and physically. And so I just looked up to them. They didn't have to say much. My dad never had to spank me, man. There was no way I was going to mess around in that Sergeant Major's house. Are you kidding? Because of the way the man carried himself. And so I think when we talk about generational changes, that's probably something, that in my generation, I believe we're trying to be more open, right? We're trying to share our feelings more than maybe didn't happen in the past. So I think that might be an interesting topic.
Absolutely.
Awesome. Yeah, definitely. And it goes to show that the talk about health doesn't always need to necessarily be a talk. Sometimes it's action. Sometimes it's reinforcing a particular idea, like this idea of being limitless, or this idea of advocacy, making sure you go get checked up. So I want the audience to really grasp onto that, to understand that, when we say the talk, yes, it's great to have an open conversation, but sometimes actions do speak louder than words. So I want to piggyback off of this discussion just a little bit more. So, Mr. Williams, how do you talk to your children about their health and about the importance of maintaining their health?
Yeah. I took a phased approach in raising my children based on the model that I received myself, right? So I tried to pick age-specific topics. So as they were coming through, their different phases of life, I would give them little things, right? And I would try to relate it to something that when you're 5, you can understand. When you're 13, you can understand a little bit more, a little bit differently. So as they were going through, I'll use, my daughter, as she's shorter than me and she ran hurdles like I did because she's got that lion's heart, right? But I would use whatever she was interested in and try to relate that to how that event or that engagement is important and how she should be developing her success tools. And I give you an example. She was a tenacious student. I mean, the young lady did everything and, participated in sports, above 4.0 GPA. She's in student council. She's all over the place, right? I used to have to go into her room at 2 o'clock in the morning, go to sleep, right? So based on the personalities of my children, I would go, okay, let me give you some tools, right? You're stressing yourself out here. You're doing this, let's think about that. So I offer that what worked for me was, what is the child's interest, right? And then how as a parent, can I give them the tools to be successful, to be smarter based on where they are in their life and what they're interested in. So that's the approach I took.
So Dr. Hubbard, same question to you. How have you had these types of conversations with your children?
That's an interesting question. And what's so fun about it is that it makes me think about it, think about things that we're doing, why we're doing them and all. I did pretty much the same thing that Mr. Williams did. He had a nice upbringing that he grew from, and I did also. And, again, I had mentioned that it wasn't really an overbearing kind of upbringing for me. And so I really haven't been an overbearing type of parent either. I wanted to provide structure. And so one saying that my kids will remember me always mentioning is that, hey, look, I'm not going to get you item A, B, or C, or just give you money just for breathing, just for being here and being alive. You have to work for it. You have to figure it out, and I will. You can get everything that you want out of life. You have to be willing to pay the price. And I'm not gonna. There's nothing that I won't give you or life won't give you. But you have to be working toward that. I would consider that kind of my version of the talk for them. And we're always able to refer to it. They are always more interested to take responsibility for what they're doing, their own outcomes. I say always, but that's a developmental piece, really. I would say that's kind of my general approach. We might, and now my sons, that's also like a subset, like what you're saying. I do tailor the talk a little bit differently for young men. We do tend to have a different approach. We have different circumstances, and part of what I grew up and I heard that can be challenging is that as a man, as a Black man, we have to be twice, 3 times, 4 or 5 times, better in order to eat, to achieve some of the same circumstances and outcomes. And, I don't necessarily say that, but I do make him aware that everything is not the same. And, you have to keep your eyes open and figure out how it is that you're going to achieve the goals that you want to achieve. I have never, not one time, said that, well, you're not going to be able to do this because, never, not one time. And so, I like to evoke curiosity. Where is it that you want to go? And then we have to figure out how we're going to get there. Is it going to involve Fortune 500 company? Would it involve a big, large organization like the government? Or are we going to get there by way of our own business, something that we start and grow? Multiple different ends to where we want to go. So that's my general approach toward my kids.
And thank you for sharing that. And I want to point out here that from these stories, we can hear that there's very different ways to have this talk with your children. And there's no one right way to do it. But I think the key that I want the audience to understand is about having honesty and open conversation, right? And that's how it starts. It doesn't always have to be a blunt breakthrough into the discussion. And sometimes it just starts slowly and as you grow. So now I want to transition us over to discuss the cancer journey of Mr. Williams. But before I do that, I would not be doing my job as a medical director and scientist if I didn't provide just a little bit of statistics on cancer, okay? So according to the American Cancer Society, in 2022, it is expected that approximately 1.9 million Americans will have a new cancer diagnosis. That's 2 million very difficult conversations to have. It's expected that 600,000 cancer-related deaths are to occur in 2022. That's 600,000 final moments, right? And cancer is the second leading cause of death in America, only exceeded by heart disease. And I don't want to paint such a grim picture before we have Mr. Williams speak, because 26 million Americans are expected to be cancer survivors by the year 2040. Okay? So all hope is not lost. So Mr. Williams, can you describe for us how you felt when you received that diagnosis? What was going through your mind? What actually prompted you to go to the doctor in the first place? Just kind of paint a general picture for us to take us through that journey.
Okay. I had symptoms, I want to say somewhere around 1995, 1996, where I noticed something about myself, went to the doctor and said, oh, just keep monitoring, right? Just keep monitoring. So I did. Nothing significant until 2002. So in the early spring of 2002, I just felt horrible. It's where I just had this excruciating pain in my abdomen. In the middle of the night, ran to the ER, and then they spent 5 days trying to figure out what was wrong with me. Right? My white blood cells were way down. My abdominal pain was unbearable. Right? And the diagnosis was testicular cancer, right? That had spread to my lymph nodes. So I think type 2, not quite type 2, type 3 type cancer. But one of the things that was very significant was that my father, Audrey's and my father, had just died 2 years prior of cancer. So I was scared out of my mind. My daughter was 4, my son was 1, my wife was there. And I just had this conversation not too long ago with my sister, Audrey, that I didn't know how to approach my mother and my sister, going, oh, hey, hi, how you doing? I've got cancer. How do you do that, right? So I was totally flabbergasted and absolutely scared because what we had just lived through with my father, right? And so it's hard not to get emotional. But the thing for me was there was an absolute switch. And when I say, be an advocate, be a champion for yourself, I mean it because I lived it. Because at that moment, the first thing that came to my mind is, I want to see my children grow up, right? So I'm going to do whatever I need to do. So I'm sorry, it's very emotional. But it was an absolute commitment that I was not going to simply, go quietly into the night. So if I may just kind of stop there, I'd appreciate it.
Sure, absolutely. Yeah, so I hear this idea of advocacy and being a consumer advocate. You mentioned earlier that you actually went on an experimental cocktail for treatment because the standard treatment just really wasn't going to work for you. And you credit that experimental cocktail and those clinicians for saving your life.
Yes.
So, that's very powerful. And often, as I mentioned before, there's a lot of medical mistrust within our community, but you had a lot of trust in the medical healthcare system. So I want to actually go to Dr. Hubbard. As a clinician, how do you combat this idea of medical mistrust with your patients?
That is something that I think it comes from our background in being true to it to a degree. I grew up, I said, in Cleveland, but I pride myself from being from 125th Street and Buckeye Road, a very much, there was a barbecue joint right around the corner. And I had aunts and uncles that were in various types of trouble with drug exposure and the law. I could always get a good haircut around there. There were churches around. I mean, it was just the perfect setting to really understand different swaths of people. And I consider myself a product of that environment, but also multiple types of environments to be able to talk to multiple different types of people. And when I'm walking through the hospital, and there are people that work here that are, let's say they're in environmental services, maybe they're patient transport, maybe they're security, maybe they're nurses, and then also other physicians, but, and patients. And I let them know from Jump Street, how I introduce myself, how I shake their hand, how I acknowledge them that, hey, I get you, I get you. I know I understand your background, and even circumstances when I don't understand them, that I'm open. I'm not judging you. I'm here to understand. But many times, if it's people that are from our shared experience, then they get it just from the standpoint of our meeting. And sometimes there's a little test that they ask me to pass, you know, and just how they say hello and how they hear hello back to me. But after that brief test that, happens in a fraction of a second, people realize that, okay, he's open to hear and understand. They feel the compassion. They feel that I'm accepting how they see themselves. Both of these are very important. And they feel that I want to work with them. They don't feel a heavy hand coming down on them. Here's what we're going to do. What they hear is, here's what I recommend. Here is perhaps what I would do for a family member. When I have their trust, then people will ask me. Let's say that this was your uncle, or your dad, what is that you would recommend? And when people ask me that, I know that I have already crossed some thresholds of trust. And so, but there are certain postures, certain words, certain faces that I bring in order to facilitate that. Maybe I don't stand up in the room. Maybe I sit down and I'm eye to eye. Maybe I have my hands folded. Maybe I have my legs crossed. I mean, we have to be able to communicate that we're open and available to meet where you are and figure out with you what seems like would be the most appropriate approach.
Dr. Jeter, can I pick up on that, please?
Absolutely. It's going to transition to you anyway, so you're right on.
Thanks. So one thing, Dr. Hubbard, you just reminded me of my interaction with the medical team there in Detroit. The first doctor that I saw was a mid-level rank Air Force officer, and I felt he was dismissive, right? Like he was the one who just wanted to send me over to Great Lakes Medical Care. I didn't feel any love from the man. So I took it up the chain to his two people up, and I finally got to a colonel, an Air Force colonel, who was the gentleman the doctor who referred me outside, right? Because I believe I was able to articulate my desire to live, right? My commitment to, hey, I'm not going out like this. And that second doctor, bless him, took the extra step. He didn't have to, but he took the extra step to refer me out to a specialist who, by the way, he knew of. I don't know what the relationship is. I never found out, but he knew of this other doctor, right, in the civilian side. So the cultural things that you experience, we all know what you're talking about, Doc, right? It's the test that we all have to pass every day. Oh, you're the one, right? How do you carry yourself? How do you pronounce the words? Whatever it is. I strongly believe that the way I presented my case and myself resulted in action by a senior officer. So that's another thing that I would carry over, is that we have many challenges within the topic that we're discussing here. And I think before I forget it, because I'm about to be 60, so I start to forget stuff. Before I forget it, I want to say that sometimes people aren't able to be their best advocate. So in addition to that, how are we helping our brothers and sisters? How are we being advocates for them so we can communicate to them that we can help them, we should go with them, and then we communicate their story, their desire to live, to the people who are in a position to make that choice for them, to give them that extra medical care, right? So that I just want to leave that as I think a very important thing that I was able to do for myself, but not everybody else can. Thanks.
Absolutely. And there's that theme again, that idea of advocacy, whether it be self-advocate, consumer advocate, or whether it be, you are an advocate for someone else. That's a really powerful tool. And I really want the audience to understand that when we talk about talk and health, advocacy can go a very, very far way. And Dr. Hubbard, from hearing your stories and your discussion, you have compassion, you have understanding, you have empathy, and, even small things like nonverbal communication can go a long way. So great work, and we need so many more clinicians like you. So I want to start transitioning us into our closing remarks now. So for the panelists, I just want to ask, what are a few takeaways that you have for our audience members? I want you to think about what the discussion that we've had today, when is the right time to have the talk about health? How do you start that conversation? So really just tell us what you want the audience to leave here with. Either one can go first.
Doctor, go ahead, please.
Anyone.
Okay, so I'm encouraged by Mr. Williams' story and what he was able to initiate for himself. And also I'm encouraged by the clinicians that spoke for him and that also advocated. I think it's very important. I think it provides a message for all of us that there are links to how we can get from where we are to where we want to be from a health and medical perspective. There's a lot of expertise out there. There's a lot of technology out there. How we get it availed to us, many times it's a social connection. And now the other thing is, I just want to tell a brief story about, I went from Florida A&M and then I worked briefly at Pfizer for a couple of years as a research biochemist. And when I was leaving, my exit interview from my supervisor, we were walking around the block and he said, what I really appreciated about you was that when you worked here, you knew everybody knew you, everybody liked you, but you also did not come here with a chip on your shoulder. And I just want to say that we really appreciated that. Now, this was, there wasn't a part of my a description of a part of my job description that said, please don't come here with a chip on your shoulder, But somehow he mentioned that and he wanted to sit that on me, But I think that's probably a big deal. I didn't know why he was telling me that, but in my travels, if they're work related, if they're health related, if I'm trying to buy a new car, a new home, if I'm talking to my kids, and if I'm suggesting to somebody else that, hey, you know what, you can get what it is that you want to get just by being proactive. And so we hear in Mr. Williams' voice the proactivity. And we don't hear that he's telling people, you don't care about me. He noticed that he wasn't feeling that what he needed to feel, that bond, and he went another direction until he felt that bond. I think that there's a lot to be said for that. I think that would be my version of the talk, that what you want is out there. The life that you want, the health that you want is there. We can get it, and we can get it if we just keep our eyes on the prize. And that would be, my overall kind of message that I would promote, really.
Thank you. Mr. Williams.
All right, thank you. What a great opportunity. So I would say that I am alive today, 20 years after my diagnosis, because I chose to live, right? I chose to do everything to heal myself, and I trusted my support system. That was the result, to answer your question from before, Doctor, that my life experiences from a child to manhood allowed me to trust. Once I believed that trust was validated, right? So as Dr. Hubbard just pointed out, once I found that right team, then I put my trust in the team, I followed them. And I'm happy to say that, hey, everything works today, right? Because things are good. If you follow the process, you can be healed, right? Cancer is not always the end state. So thank you for this opportunity. And I would leave you with two thoughts going forward, right? One, be your own advocate, be your own champion. And by that, I mean, learn to research to get facts, right? Let's not live in the past of all the things that were challenges to us, to include bad information, misinformation, right? But let's get to the facts. And then build your support networks to inform your decisions, because I didn't make my decisions on my own. I had family members who validated what I was thinking, who made me feel comfortable to trust the system, right? So that was the first thing, be your own advocate. And then secondly, and this worked for me, is cultivate your spiritual self. And I'm not talking about following a specific religion. I'm talking about believing in your heart that life is a wonderful gift to all of us. And we are connected to everything. So regardless of how you believe God or whatever, we are all connected by something, right? So I would say, cultivate your spiritual self, make yourself spiritually strong so that you can help yourself. And more importantly, you can help others, because that's what I heard today, right? Thank you, Dr. Hubbard. Thank you, Dr. Jeter, because we are trying to help others, right? It's not about us. One of the proud moments in my life is being a member of the US Coast Guard, because I saved thousands of lives, right? I'm a graduate of the National Search and Rescue School, and our motto is that others may live. Right? What a wonderful thing. If you can cultivate your spiritual self so that you can share joyously with others, isn't that what all doctors want to do, right? They want to help us all to live those joyous, full lives. So thank you for this wonderful opportunity. I'm so honored. And yes, please, continue. And I think, I'm sorry, there is the third one, and that is a challenge to all of us. Let's build those tools to enable our brothers and sisters to be their best advocates. Thank you.
I love it.
Thank you, gentlemen. Those are wonderful takeaways from our conversation today. So that actually concludes our discussion today. I thank you so much for joining me here today, just to have this open and honest discussion. For the audience, I want to leave you with just a few themes that we collected throughout our discussion today. One is about the power of advocacy. Two is about the power of being proactive. You can hear from the stories today that proactivity really is key. Don't just sit around and wait, but to really be proactive and take charge. And three, it's that it's always the right time to be having these conversations about health, right? It may be in different ways. It might be more behavioral based, but there's never a wrong time to have these types of conversations. I see that we do have a few questions from the audience. I will ask one just for the sake of time. So one audience member asked, what advice do you have on the language or words that we can use to demonstrate our absolute commitment to health so that doctors understand and recommend the best treatment plan for us? I'll position over to you at first, Dr. Hubbard.
Okay. Let's see. What words can we use to make sure that doctors are recommending?
Doctors.
Okay. Okay. From a patient standpoint, I think that it definitely helps when I understand that a person is interested in optimal health and optimal well-being. And it is a word that I share with patients that are leaving my care in the hospital. For instance, a person who's had a stroke, they've had it because their blood pressure is too high. I know that many people have high blood pressure. It's like one of the most prevalent conditions in the world, and particularly in our communities. Many of us are taking blood pressure medicines, but our blood pressure is still not controlled out there on these medicines. And a lot of that is because we are not that, let's say, ambitious regarding our health. And also, the healthcare system is very conservative. And so we'll recommend the medication to bring the blood pressure down, but it's still not optimal and it's still not ideal. And so I usually recommend to people that when you go back to see your general practitioner, ask them, what is it that I have to do to achieve ideal and optimal, quote unquote, blood pressure values? So those are my words that I usually recommend, ideal and optimal, so that we are aiming for that. Because when we listen to Mr. Williams' experience, and I'm so happy and honored that he shared that with us, that sensitive information. What we hear is that he's asking for, hey, look, I want the optimal outcome. I want the best outcome. I want the most ideal outcome. He did it for himself. And that's what I recommend, those words.
Thank you so much. Oh, Mr. Williams, you have something to piggyback.
I would give you one last
before
thing
we
to think
close.
about. I would ask this question: what are we going to do to cure this ailment? Right? It's a team thing. So I would hold your medical team accountable by pulling them in using the we word.
Awesome. That's a powerful word too, right? Team dynamics goes a long way. Okay, well, unfortunately, we're out of time. We're not able to take any more audience questions. We thank everyone that tuned in for our discussion today. I thank you, Mr. Williams. I thank you, Dr. Hubbard, for allowing me to do this type of interview and have this discussion with you, right? We're all here to help others, and that's the importance of what we wanted to get from this event today. So with that, please enjoy the rest of your day, and thank you so much for taking the time to join us.
Thank you, Dr. Jeter. And Mr. Williams, I appreciated you and your story. Thank you so much for sharing.
Oh, thank you, doctor, and all the best. Appreciate what you do, sir.
Appreciate you. Have a great day.